I think we probably should take some time to look at the organs now. This is a specimen of a pig's heart. It looks very similar to a human heart, and what you can see is it's a muscle pump that has 4 chambers. This would be the right ventricle. You see the attachment of the tricuspid valve to the heart muscle. This is the left ventricle. Again, the heart is a 4-chamber structure. This is the mitral valve right here that separates the left atrium from the left ventricle. Right here you can see the coronary arteries that supply blood to the heart and coronary veins that take blood back. This white substance is fat, and we know that in patients who have metabolic syndrome or excessive amounts of body fat, there tends to be excessive amount of fat on the heart itself. This is the atrial appendage right here. And these are the great vessels that leave the heart, the aorta and the pulmonary artery. When a person has metabolic syndrome or has diabetes or hypertension, they tend to have elevation in their lipids, and they tend to develop blockages in their coronary arteries, which can result in a heart attack. Their heart muscle tends to get thick if they have high blood pressure, which can lead to heart failure and other problems such as heart attack. This is a specimen of a pig's heart, but it looks very, very similar to the specimen of a human heart. This is a specimen of a pig's liver. Again, it sits under the diaphragm in the right upper quadrant here, and this is a healthy appearing pig's liver. It's been kind of sliced up and mutilated just a bit from some of the kids touching it, but the gallbladder actually sits in here, and you can see the arteries to the liver. And what we had talked about is the liver actually filters out poisons from the body, and one of the things that can happen with childhood obesity is infiltration of fat into the liver, which can actually cause an inflammatory process, scarring, and the worst case scenario, or the worst possibility, is actual cirrhosis of the liver, which is something that we typically see in adults from alcohol abuse long-standing, but this can certainly occur with fatty infiltration in the liver. Again, this is a pig's liver, which looks very similar to a human liver, and this is a normal specimen. This is a specimen of a pig's lung, and this lung has been sliced through the hilum, that is where the airways and where the great vessels go into the lung, so that you can actually see the cartilaginous structure, the airways. These little lines are specific for pigs, I am told by the pathologist, and they're called stria in through here, but this is a healthy, normal appearing airway. You can see branches from the airway which carries air down into the alveolar sacs in the distal part of the lungs, turn into bronchioles. And if someone has asthma, again, which is more commonly seen in obesity, this is where the airways actually constrict to cause bronchospasm and asthmatic sorts of diseases. These are lobules here where the actual gas exchange occurs. And there's some pigmentation in this pig's lung. Now, I'm pretty sure this pig didn't smoke, but he did breathe the ambient air that we have around, and so there's some carbon particles that you can see actually from air pollution that the pig actually breathed. So if I turn this lung over, now recall this was a section that we opened the lung up so you could see the airways and the vessels. This is the outer surface of the lung. This is the pleura. You've heard of pleurisy. If you get inflammation of the pleural surface, this is what really hurts. This is the pleura. It can become inflamed. Take a deep breath, it hurts. But this is a specimen of pig lung. This is a specimen of pig's kidneys. Now these are normal kidneys. They're about the same size of human kidneys. This is the external surface. You can see a little bit of fat around the kidney, but there's been a section made through here. This is the cortex of the kidney, and this is the medulla of the kidney, and this is the collecting system, actually where the renal pelvis is and where it turns into the ureter. Now, what can be affected by obesity in children on the kidney. Actually, it's a long-term effect. If they have high blood pressure or diabetes, then there's some long-term bad effects which can occur with the kidney. Obviously, this is a relatively healthy kidney as seen in the pig. This is a whole kidney, and this is a section through here to demonstrate cortex, medulla, and collecting system of the kidney. We know that if we don't correct childhood obesity, that the generation to follow will have a shorter life expectancy than their parents. Childhood obesity can be prevented by your healthy lifestyle choices. These would include proper diet and exercise balance. Healthy diet choices include a good breakfast, proper portion sizes, good fast food choices which include grilled foods, salads, no supersized portions, yogurt and low-fat dairy products, and at least 5 fruits and vegetables per day. Remember, fiber is important, especially in fruits and vegetables. We recommend avoiding excessive amounts of sugar, such as would be seen in sodas, candy, crackers, and chips, such as from a vending machine. Lean meat or fish in proper serving sizes is also important. Exercise daily at least 1 hour, and it's okay to divide the exercise up into 30 minutes and 30 minutes or 20 minutes, 20 minutes, and 20 minutes, but 1 hour of vigorous exercise per day is important. Other healthy lifestyle choices include proper amounts of sleep, avoidance of drugs, alcohol, and tobacco, and remember, the person most responsible for your health is you. I hope these comments that we have made today turn out to be very useful in decisions that you make in the future, because in my own experience, I can say that habits that I have developed early on tend to be maintained throughout my entire life. Good luck.